Hey there, I'm Dr. Catherine Foray at University Veterinary Hospital. Let's talk about dog and cat vaccines. This is a really big topic, so I've broken it down into 3 sections. The first section, what is your pet's risk factors? What is their lifestyle? What is their life stage? The second section is all about vaccination education. We're going to talk to you about the name, what we're protecting, and how long that protection usually lasts. And then the last section kind of zones in on UVH Vets Unleashed section, where we're talking about the requirements for boarding, grooming, daycare, and our coaching programs. Before we get started, I'd like to tell you the why behind this video. Why do we want you to have this information? We think it's important that you understand our process for determining vaccines for your pet, what they may need, what they may not need. It is our top priority to make sure everyone's pets are safe and healthy and protected. There are 2 major criteria to determine if your pet is at risk of contracting a disease. The first one is your pet's life stage. This is easy, it's their age. There are 5 stages that we like to look at in veterinary medicine. The first one, pediatrics. Puppies, kittens, let's really jumpstart their immune system and get them through a series of boosters that are timed out. Then there's the juvenile stage, and this is awkward. They're not a puppy or a kitten, but they're not quite an adult. Most vaccines require a final booster during this stage. It's about 1 year of age. Then we hit the adult section. This is the fun part. They're really grown into their body, and we have years of fun with them. Then we hit the senior zone. This is on average in our breeds of cats and dogs when they turn the age of 7. That's right, senior at 7. So besides adjusting their vaccine protocol based on their lifestyle, we also want to talk to you about wellness screens, looking at their blood and urine to understand what's going on internally. And then our final section, oldies but goldies. This is the geriatric zone. On the average breed for cats and dogs, this is somewhere between 12 and 14. And we really begin to pull back the vaccines at this point and talk more about wellness screening and great physical exams. Now let's talk about the lifestyle. We need to ask you several questions that help us determine your pet's risk factor. How social is your pet? Do they like to go on walks? Do they live with other animals in the house? When you leave town, do they come to see us at Unleashed or a boarding facility? What about grooming? Do they leave the house to go to a grooming facility? What about the lake in your backyard? Do they like to swim in that? The answers that you give us to all of these types of questions really help determine the risk your pet takes every time they're in their house or in their backyard. Let's do a little vaccination education about your dog. There are 5 vaccines that we're going to review when it comes to dogs. Rabies. Rabies is a virus that is found in wildlife in our area, and this is a big deal. Not only can your pet, but you can also contract rabies from this wildlife. So it's a legally required vaccination. A puppy or kitten is going to get their first booster when they're 12 weeks of age. They get their second booster at that juvenile visit when they're about 1 year of age. And then from then on, they can have a rabies vaccine either once a year or every 3 years based upon where you live. DHPP. This is a combo vaccine that's covering distemper, hepatitis, parvo, and parainfluenza. These are all bad diseases that are difficult to treat, so prevention is really key. We can do that with immunizations. Distemper and parvo are highly contagious. We really encourage you to keep your puppy at home isolated until they are done with their full booster series. It is important that your puppy receives 3 to 4 boosters of DHPP during their pediatric visits. They'll have a final booster when they're in their juvenile stage, about 1 year of age, and then from then on as an adult dog, the DHPP vaccine is recommended every 3 years. Leptospirosis is a bacteria found in the urine of wildlife. And news alert, it's zoonotic, meaning not only can your dog get it, but you can get it too. The good news is we've got great vaccines that are safe and effective. Once your puppy is 12 weeks of age, they'll receive 2 boosters of leptospirosis. From then on, this is a once-a-year vaccine for all the dogs in our region. Bordetella, also known as kennel cough. Bordetella bronchoseptica is a highly contagious airborne bacterial infection that causes major respiratory disease in dogs and is very easily spread. Puppies will get 1 booster as a little pup, and then it becomes every 6 months from then on for social pets. CIV, the canine influenza virus. Canine flu is not like the human flu. The canine flu is a serious year-round threat, and we want to protect your pet. There are 2 strains, H3N8 and H3N2, and at this point, they have never been known to mutate. We can start a pet at any time on this booster. It takes 2 boosters to build immunity, and then this is a every 12-month vaccine. Let's do a little vaccination education about cats. There are 3 cat vaccines that I want to review. Rabies. Rabies is a deadly virus in our wildlife population that can pass to pets and people. It is legally required to have your pet up to date on their rabies vaccinations. Kittens will start off with their first booster once they're at the age of 12 weeks. They have a second booster once they're in that juvenile stage, about the age of 1. And then from then on, in their adult stage, they can have a booster every 1 or 3 years based upon where you live. FVRCP is a combination vaccine that prevents 3 potentially deadly viruses: feline rhinotracheitis, feline calicivirus, and feline pain leukopenia. During the pediatric visits with your kitten, they'll go through 3 to 4 boosters. At that juvenile visit, when they're about the age of 1, they'll have 1 booster, and then from then on, an adult cat should receive an FVRCP vaccine every 3 years. FELV, feline leukemia virus. This disease can cause anemia, it can cause the cancer lymphoma, and since it suppresses the cat's immune system, it really predisposes a cat to some serious infections. During the pediatric visits, your kitten will have 3 to 4 boosters. They'll have a final juvenile booster a year later, and then from then on, this is a lifestyle vaccine. If you have a cat that lives outside or lives with the cat that goes outside, then they need to have this vaccine every 12 months. UVH Vets has reviewed and adopted the canine and feline vaccination regulations set forth by the AVMA, American Veterinary Medical Association, for our Unleashed services of boarding, grooming, daycare, and our coaching program. And remember, at University Veterinary Hospital, our primary focus is to keep everyone's pets safe, healthy, and protected. We look forward to caring for your pet.